and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. Thousands of people flocked to the presidential inauguration last month. With so many people visiting Washington, D.C., security was a concern. While the Secret Service, police, and soldiers protected the public, they were assisted by four-legged troops. Army veterinary personnel from our region cared for the animals that helped protect the crowds and some that led the way in the parade.
The world watched the 58th presidential inauguration as the president took the oath of office. The parade moved along Pennsylvania Avenue between the U.S. Capitol and the White House, and military members were honored for their sacrifice during the Salute to Our Armed Services Ball. What you didn't see were the teams providing care for over 200 military working dogs and military horses in support of the inaugural events. Meet Richie. Richie is a Secret Service canine, and he's at the Fort Belvoir Veterinary Clinic having his annual checkup.
TPR is normal, diet is 3 cups of lamb and rice, no concerns by owner.
He's an explosive detection dog, so he will go off and sniff for explosives, whether it be in vehicles, open areas, hotel rooms, anywhere protected he might be, up on a stage with a podium. He's looking for explosive odor. He doesn't view it as work, he sees it as fun.
So right now we are in the TAC room at the Old Guard Caisson Barns here on Fort Myer, and we're here today because we are discussing the veterinary support for the Caisson horses that participate in inauguration.
So the Old Guard provides us the manning, so we have basically a 50-man platoon, and this is our daily job, is taking care of the horses and doing funerals in Arlington. I know personally myself and my soldiers are very excited to be in the inauguration. The horses and the riders will be part of the parade.
I just think I would like to reiterate just how incredible these horses are. They are amazingly well trained, and it takes a lot for a horse to be able to go out and participate in a parade with all of the excitement and things going on. And these horses and the staff here that do their training have just done such a great job with them. It's just really an honor. It is just incredible to be a part of this, to be a part of the joint team, you know, seeing all of the services come together to work on this event and to be in support of the peaceful transition of power of our civil authority.
The Airborne Soldier is an iconic element of the Army, but no one in the Army goes it alone. The courage to jump from an airplane requires the support of men and women who ensure they can land safely. The responsibility of maintaining personnel parachutes and airdrop equipment is entrusted to riggers. Physical therapists at Kenner Army Health Clinic at Fort Lee, Virginia, are helping future riggers maintain their medical readiness.
Army recruits at this 13-week parachute rigger course become proficient packing their parachutes over and over again. With so much going on, injuries can come out of the blue.
We see a lot of patients coming through with the same repetitive injuries, and our main goal is how do we get ahead of that and how do we prevent them from happening so they never have to come into our clinic in the first place. As a schoolhouse, we have a unique ability to get at the forefront of these soldiers that are coming through and just learning how to do these jobs that they're going to do for the rest of their career.
Every day it's just lifting, pushing, pulling, physically demanding labor, but I think just the manual physical labor every day of being a parachute rigger is what's caused the extensive damage.
So what we're doing here is we're re-educating shoulder stability. So we're taking a patient who needs to be aware, more self-aware of her body and how she uses her shoulders in these specific movements. Up towards the ceiling here. Good, good, good. And let it sink again.
Physical therapy is what has made it heal to what I feel is now back to 100%. Because my injury was so long ago, I forgot what it feels like to have a strong, healthy shoulder. And now that I have one, I don't know how I went the last 6 years in pain every day.
Putting a patient back in control of their own life and in control of their pain and knowing how to take it away is a very empowering element.
Now Staff Sergeant Greer gives back the knowledge and experience she's learned.
There's never been a day when it's not worth it. I wake up excited to come to work every day because I know somewhere during that day I'm going to be able to share something with a patient that they didn't know before. So when I can have somebody come back and tell me that they're still feeling good down the road because they've learned how to take care of their body, that's the best reward I could ask for.
That's the Regional Health Report for February. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. Starting this month, you'll also be able to see our program on the Defense TV app. The new Army Medicine channel will feature the Regional Health Report, as well as other programs and videos from our region and across Army Medicine. Check your television streaming device or the App Store on your smartphone. Thanks for joining us.